So, non-invasive brain stimulation. How invasive is it? My name is Danielle Yachnes. Good afternoon to everyone. Let's get started.
My name is Anish Kumar.
My name's Kendall Smith.
My name is Michaela Martin.
My name is Jay Kelly.
My name is Runzi Hu.
And my name's Corinne Linen.
All right, so we'll start off with a quick overview. And as the field of neuromodulation continues to grow and develop, it's ever important to not only focus on the various benefits that this technology has, but also the ethical, legal, and social implications of it as well, particularly with the use of NIBS, or non-invasive brain stimulation, targeting regions of the prefrontal cortex to help treat various psychological disorders such as anxiety and severe depression. Now, this raises various ethical concerns as well, such as what are the effects of changing one's cognition on their behavior and how they react with others? And finally, is DBS, or deep brain stimulation, a viable long-term and permanent alternative to treat these kinds of psychological disorders? So just a quick proposal outline you can read through if you'd like.
When we look at the literature that exists for the treatment of psychiatric disorders using non-invasive brain stimulation, we can see that most of the research is focused either on transcranial direct stimulation or transmagnetic stimulation, both of which work by increasing neuromodulation in the brain. This is what makes it effective against treating depression, which is characterized by a lack of neuromodularity. However, when we're treating other conditions which are not reliant upon increasing neuromodularity to see a response, it can raise certain concerns because we can see that there will be changes to the brain, which isn't necessary for the treatment of the condition, but nevertheless can create unintended consequences. Further, especially when we're using direct current stimulation, we can see that it's not very exact in the regions that it targets. So a ripple effect can be created. So even if we would like to target a certain area of the brain, others may still be affected in ways that we cannot foresee and in ways that we do not like. Further, although non-invasive brain stimulation is often targeted as a non-invasive and reversible treatment where one can go on and off of it, such as you could with a medication, it is actually quite the opposite. We have seen again and again that there are physiological changes to the brain following the use of NIBS, one of which, after using transmagnetic stimulation, which works by inducing action potentials in the brain with low frequency inductions being inhibitory and high frequency being excitatory, that there is a permanent change in the resting action potential of the neurons, which can be used to treat the condition we are targeting effectively, but it can also create unintended effects since we are permanently altering the brain. Further, it has been proven that there are changes in the cultures of hippocampal cells which have undergone TMS. At a lower intensity, it is seen that axonal absorptivity and synaptic density increase, but at an even higher intensity, it is seen that both factors decrease, resulting in a disruption of the synaptic connections and layout of the brain, which is permanent. Further, we do not know the exact biological mechanisms behind non-invasive brain stimulation, so that means it is pretty much impossible to predict all of the long-term effects, especially since there is additional research that needs to be done. So really, we are looking at something that is non-invasive, as we like to call it, but yet there are still long-term effects that we cannot yet predict and that will certainly be significant.
There are many considerations that go into whether to be treated by NIBS. A main question is altering one's state of mind ethical? The mind is the reason for the life that you lead. So it makes decisions for you. It's the reason of how you think about yourself. It's a reason for your actions. So would altering your state of mind really be ethical? I'm not saying like your personality would change, but I am saying, what if the alteration caused you to make a choice that you wouldn't maybe have made before? It could change society, it could change your social relations. There's also not enough long-term research on NIBs, which could cause problems in the future, such as neuroplasticity. And there are legal considerations to be made, such as privacy and informed consent.
As with any other medical procedure, it is very important to look into the considerations before you try it. But it is also important to look into the benefits. So the great thing about NIBS is that it's non-invasive, it's non-surgical. So you don't have to worry about things like getting an infection from the surgery or anything like that. There was only one case that in my research that I have found where there was a very adverse side effect to NIBS, and that was in a paper published in 2017 by two Japanese researchers, Matsugawa and Ugawa. They found that in one pediatric patient, that patient ended up having a seizure during his procedure, but like all the other side effects of NIBS, which is like itching, maybe tingling, sometimes headaches, it subsided quickly after the procedure. But the minimal side effects comes with a caveat. So you have to use NIBS responsibly. So for my parents and for my future parents in the crowd, even if your kid ends up with a 12 on their SAT, cumulative, that is not a reason to put them on NIBS for 24 hours, 7 days a week. And there has also been data shown where NIBS has been very effective for the disorders such as TRD, which is treatment-resistant depression. It has helped these patients reassimilate themselves into society because treatments from beforehand, like medicine treatments, were not working for them.
As we in our group were discussing NIBS and any possible alternatives, we thought about DBS. So DBS, deep brain stimulation, is not currently being used to directly enhance the prefrontal cortex. However, it has been used in studies to enhance the internal capsule, which can enhance cognitive function because the internal capsule is a leading system that connects to the prefrontal cortex. What that means is that the cognitive function, your ability to remember things, to learn, all the things that you would need to make social connections, those are all things that could be influenced by using deep brain stimulation on the internal capsule. So the other day we had the honor of talking to Captain Shana, and he told us our experience with DBS. And even though he had such an enriching life before he was diagnosed with Parkinson's, he was able to come out of the procedure with the outlook on life that no matter what kind of day it is, he thinks of every day as a gift. So we should use that and remember that when we think about these patients with neurological disorders.
So essentially, yes, brain stimulation is worth the risk, but only after every other treatment has been exhausted. Due to the severity of these conditions, any progress is still good progress, even if it comes with minor side effects. For the patient that is attempting this treatment, this truly is their last resort.
There are some limitations to go along with NIBS. Like said in multiple other slides, long-term brain stimulation has research gaps. It's not been a technology that's been here for a while, so we don't know what's going to happen in the future with it.
And particularly with pediatric patients, this raises a lot of ethical concerns as to what the long-term effects would be when using technologies and techniques such as NIBS and DBS on them early on. Additionally, the concept of neurodiversity, which is perfectly encapsulated in this quote above, "Once you see one mind, you see one mind." And what this means is that every individual's mind is different, which means that everyone needs to be operated and diagnosed individually with their own set of rules and regulations. This is also why clinical applications of NIBS and DBS are much more effective, and the responsible use of these technologies is necessary for effective outcomes with less adverse effects. This brings up safety concerns with irresponsible use, which there are many cases of, particularly in the direct consumer field, which is why it's important that NIBS and DBS should be used responsibly in a clinical case only. So our concluding remarks here is that NIBS is overall a very successful and viable treatment for various psychological disorders, again, such as anxiety and severe depression, ADHD, OCD, and others. However, there are still plenty of ethical challenges and considerations that must be discussed to patients and their families before this treatment is approved for them, because again, informed consent is paramount. These ethical challenges and legal limitations are not a blockade to using NIBS and DBS for patients that really need them, but rather a set of guidelines that they should follow for effective outcomes.
So when thinking about NIBS and future possible DBS treatment, we have to consider ethical concerns, we have to consider responsible use, and we have to consider, first and foremost, the viability of this treatment for patients with neurological disorders. Thank you.